In the earlier class, we have, we have seen the etiological characteristic of disease syphilis. Now, next to that, etiological and epidemiological characters of syphilis disease. In concern to the next of this disease is the pathogenesis and the symptomology. Now, the simple meaning of the pathogenesis is, is how disease is developed. How disease is developed in the human being. That study we call it as a pathogenesis. How this pathogen enters into the host body, where it multiplies, what part of the body it affects, all these points, they have been covered under the heading pathogenesis. And the next is the symptomology. Means what kind of symptoms that host shows after it get infected with this pathogen. That is Treponema pallidum, which causes this syphilis disease. Now, in this pathogenesis and symptomology, the origin of syphilis is definitely not definitely known. It is unknown from where it is originated, from which time, which period it is originated. It is unknown. But towards the end of the 15th century, this syphilis disease, it is widely spread throughout the Europe in a particularly virulent form. Means most of the European countries, they have been affected by the syphilis disease in the 15th centuries. Now the name syphilis, it is derived from a poem which is written by Fracastorius of Verona. He is a poem writer who wrote this poem in 1530, describing a legend shepherd who is named as a Syphilis. He described a person which we call it as a shepherd whose name is Syphilis. And this is the person who is firstly affected by this syphilis disease. So, by this disease, that's why the name syphilis is given to this disease. It's because of the person who is affected by this pathogen firstly. So that's person's name, it is given to this disease. That is syphilis. Now, this disease, it is believed to be that this syphilis disease is a new disease which is brought from America by Columbus Cruz. The Columbus, who is a person who firstly traveled a lot, and his cruise carried this disease towards the other part of the world. So this transfer of syphilis disease is mostly carried out by the cruise of Columbus. Now the natural history of this disease is undergone various alterations, but syphilis continues to be one of the most important and widespread disease of human beings. Okay, it is one of the most important widespread infection of human being. And natural infection of this Treponema pallidum, who is a causative agent of the syphilis disease, only occurs in human beings. Means there is no another host is there for this pathogen to affect. So it only affects the human beings only. But in experimental condition, we can infect the monkeys. In laboratory condition, we may infect the monkeys with this pathogen Treponema pallidum. But the only infection of this Treponema pallidum, the causative agent of syphilis, only occurs to the human beings only. No other animal, no other host is there which is affected by this pathogen. Now, how this disease begins? Mostly, those syphilis which is transferred through the sexual contacts, which is acquired through the sexual contacts. Such syphilis, it is known as a venereal syphilis. Means syphilis which is transferred, which is the mostly this disease, syphilis disease, it is mostly transferred through the sexual contacts. So that contact transfer of such an infection, it is known as a venereal disease. Those infections which are transferred from patient to healthy person through the sexual contact, such disease is known as a venereal disease. Now this spirochetes, that is Treponema pallidum, it enters the body through minute abrasions on the mucosa or skin. During the sexual contact, there is some kinds of abrasions are there, through which it can enter the mucosa and skin, and infectivity of a patient to his sexual partner, it is maximum during the first 2 years of the disease. Means a person is suffered from this disease, but his partner is not affected by this disease. But in such condition, there is a higher chance that her partner or his partner may get affected by this syphilis disease in the earlier first 2 years of the disease. That is primary, secondary and early latent stages. But after 5 years, the risk of this syphilis disease, it is minimal. It is considered to be a minimal disease. Now, how much amount of this pathogen is required to produce this syphilis infection in a host? It is estimated that it is a very small amount, as few as 60 treponemas being capable of infecting 50% of human volunteers. It is estimated in a laboratory that only 60 treponemas, they are sufficient to infect out of 100 volunteers. Near about 50 volunteers, they can be affected by this much amount of treponemas. Only 60 treponemas are sufficient to affect 50% of the human volunteers which are participating in the laboratory experiment. Now this pathogen, once it get entered through the mucus or skin, it multiplies at the site of entry. From where it is entered into that host body, it multiplies at the site where it is entered. Now the generation at time of this pathogen, means one pathogen get double. That is, we call it as a generation time. It is up to 30 to 33 hours. Means this much time is required from one Treponema bacteria to convert into 2 bacteria. This much amount of time is required. So the generation time is very, very long. Now the clinical setup of this disease occurs after incubation period of a month. Means once this pathogen entered into a host, healthy host, where it multiplies, but the clinical symptoms of this disease only observed after an incubation period of 1 month. After 1 month incubation period, there will be occurrence of the symptoms, clinical symptoms in that host which is affected by this syphilis disease. Now, the clinical manifestation means how this disease is recognized in terms of symptoms, that has been followed in 3 stages. That is primary, secondary and the tertiary. These are the clinical manifestations. Means how this infection, how this disease develops in a healthy host. That falls in 3 stages: primary, secondary and the tertiary. Last is the tertiary stage. So the amount of treponemas which are required to infect human volunteers, up to 50%, it is of 60 treponemas only. While other diseases, it requires large amount of bacteria to present in the source. But this much amount of treponemas, they are sufficient to infect 50% of the volunteers, human volunteers. So, first stage, that is the primary stage. That primary stage of the syphilis, the first stage of the syphilis, it is called as a primary stage. The primary lesions which are observed in syphilis is the development of a canker. Development of a canker at the site of entry of the spirochetes. Where these bacteria have entered, at that site it developed cankers. And the most of the times these cankers, they are developed on genital organs, where they are most commonly developed. But sometimes the other common sites where this pathogen can grow, these are the mouth and the nipples. These are the other sites where this pathogen can also, through which this pathogen can enter into a healthy host. But in most of the cases, these cankers, they are developed on genital organs of that particular host. But sometimes these cankers, they may not be visible because they are present on certain parts which are not visible, such as uterine crevice. This is the part where these cankers may be developed, but they are not visible. So these are the parts which are affected by this pathogen. The most part which is affected in that healthy host is the genital organs of that host. And sometimes this pathogen may affect the other sites such as mouth and nipples. And these cankers which are developed at these particular sites or particular organs, they are painless. Means they don't feel any pain after the development of these cankers on that organ. And this characteristic of these cankers, they are particularly avascular, circumscribed means limited, they are limited in size, indurated means there is a swelling is there, and these regions, they are superficially ulcerated lesions. They look like ulcers, ulcer type of lesions, they are there. And this type of cankers which developed at that particular site, they are known as a hard cankers because of these characteristics. Limited is there, these cankers, they are avascular, painless, circumscribed means limited growth is there, limited spread is there, indurated means swelling is there at that part, and these are lesions, superficial ulcerated lesions are there. These are the characters of cankers which are developed at the particular site where the entry of this pathogen takes place. And these cankers, they are particularly covered with a thick, glary exudate. There is exudation is there, means secretion is there, which is rich in very, very large amount with spirochetes. Means at the site where it, as you know that this pathogen multiplies where it entered. If it entered at the site of genital organs, it multiplies there. If it entered at the site of mouth, it multiplies there. And there is a development of cankers. And this pathogen, after multiplying there, they affect the other parts. They affect the regional lymph nodes, which are swollen, discrete, rubbery, and non-tender. These are the characteristics which are shown when that pathogen enters the lymph node of that person. And even before the cankers appears there, even before the cankers they are shown visibly, the parasite spreads from the site of entry into the lymph node and the bloodstream. Means this pathogen, when entered at that site, it starts multiplying. And after multiplication, it spreads through the lymph nodes and through the blood system to the other parts of that host. Okay, so the patient may be infectious during the late incubation period due to the spread of these treponemas from the site of entry to the other parts of the body through the lymph nodes and the bloodstream, and that results into the other you can see here, these are the lesions which are developed. These are the lesions which are developed on the mouth of that person. These are the lesions which are developed on the mouth of that healthy person where this pathogen have entered. These are the cankers. These are the cankers which are shown on the mouth of that person which is affected. You can see here. These are the cankers shown on the mouth. Then these cankers, they not remain there for longer duration. पुनः तरी आवाज येतोय, म्यूट करा ते. These cankers, they not remain there for longer duration. They invariably heals, means they get cured in about 10 to 14 days without any treatment. So these cankers which are developed at the primary stage, they get healed, they get cured without any treatment in about 10 to 14 days, and they live there. Thin scar means there is a signs are shown there that there is a particular type of lesion is there. It is observed on that particular part, but it get cured. But the persistent or multiple cancers may be seen in HIV infected or other immunodeficient patients. Means those patients which are already suffering from some kind of immunodeficient disease. In such persons, the syphilis causes multiple cancers. It causes multiple cancers there in such immunodeficient patients. That patient may be affected by HIV. It may be affected by other kind of sexually transmitted diseases because of which immunodeficiency is there. And in such persons, the syphilis produces persistent. Continuously there is a presence of cancers on that person's body in the primary stage. Now the next stage is the secondary stage. Now the secondary syphilis, it comes 3 months after the primary lesions heals. Means after the primary lesions they are healed, after that healing, there is a development of secondary type of syphilis in that person which is affected by syphilis pathogen. And during this secondary type of syphilis, which is developed 3 months after the primary lesions healing, the patient is asymptomatic. Means whatever the symptoms, whatever the cancers they have been developed on that person's body during the primary stage, they are healed, they are cured. When that person enters into the secondary type of syphilis, then that person shows no symptoms. No symptoms they are shown there. The patient is totally asymptomatic. Any kind of symptoms they are not observed on that host or not shown by that host. And these secondary lesions are due to the widespread. So this secondary type of syphilis, it is mostly developed because there is a multiplication of this pathogen occurs at the primary site, and before the development of the cancers which are shown in the primary stage, this pathogen starts multiplying and starts spreading to the other part of the body of that host through the lymph nodes and the bloodstream. Through the blood, it enters to the other part of that host body, and this multiplication and the spreading of the spirochetes through the bloods system, it develops the secondary type of syphilis. And after the development of the secondary type of syphilis, you can observe rosellar or papular skin rashes on that person's body, mucus patches in the oropharynx, and candyloma at the mucocutaneous junctions. These are the characteristics which are shown in when the secondary type of syphilis it is developed there in that host who is already suffered from syphilis and who have shown the primary stage of the syphilis. And these pyrocytes, they are abundant in these lesions, and because of the abundance of this pathogen at that particular point, at that particular stage, that is the secondary stage, where it multiplied and spread to the other parts of the body, in this condition, this patient is most infectious because all the body part of that person, they are having this pathogen. So it is a super spreader now. Whoever comes in contact with these persons which are having this secondary stage of syphilis, they are the super spreaders because they carry this pathogen in his body, and through it, it can be sprayed to the other healthy person who comes in contact and makes the sexual contact. In such cases, that person may have this infection from that person who has already infected and showing the secondary type of syphilis. Now these secondary lesions, they are highly variable in distribution, intensity, and the duration. So the secondary lesions which are developed, they are showing variation in their distribution. In which part are they shown? Their intensity is different, their duration is different, but they usually undergo spontaneous healing. You can see here that patient is having infection, but it is not showing any kinds of, the person, when that person comes in the secondary stage, shows these types of symptoms, then it gets spontaneously healed. It gets spontaneously heals. In some cases, the spontaneous healing, it occurs as long as 4 or 5 years. So, this secondary stage, which is present in a particular host, it gets spontaneously healed, but it requires time, which may be 4 to 5 years. This much time is required to heal the secondary lesions which are developed in that host, in that particular patient. You can see here, this is the spread. These are the symptoms, skin rashes, which are shown by that host, that particular patient. These are the rashes which are present all over the body of that person. These are the rashes which are shown on the face of that person. And these rashes, they get spontaneously healed. And these are the secondary stage of syphilis. Because this is, after the entry, it gets spread throughout the body, and then it starts showing its presence. And this presence, they are shown in terms of these cancers. These are the various types of rashes which are developed during the secondary stage, and these get spontaneously healed. But it may require 4 to 5 years to heal these secondary lesions. Now the last stage, it is the latent stage. After the secondary lesions, they get disappeared. This period of quiescence is known as a latent syphilis. Means after the secondary lesions, they get healed, but still that person having the pathogen. And this silent period, it is known as a latent syphilis. Okay. the secondary stages. In the secondary stage, whatever the rashes that has been developed, they get healed, they get disappeared, secondary lesions get disappeared, and this period where this lesions, this pathogen is still there, but in the silent form. And such stage of syphilis, it is known as a latent syphilis. Now during this latent syphilis, this is the period. Only this period, it can be easily identified by using serological testing. Here, this latent syphilis, it can be only identified by using the serological tests. And in many cases, this is followed by natural cure. Similarly, here in this case, latent syphilis, it also get naturally cured. But in others, after several years, there is a manifestation of tertiary syphilis is there. In some persons, this latent syphilis, it get cured naturally. But in some of the persons whose resistance power is not good, in such conditions, the tertiary type of syphilis appears there. Okay. Now the latent syphilis, it can be easily diagnosed by using serological test that we are going to study in laboratory diagnosis. Now in tertiary stage, it consists of cardiovascular lesions. It mostly in tertiary, when this disease enters into the tertiary stage after covering the latent syphilis, when it enters the tertiary stage, it mostly affects the important organs. Cardiovascular lesions, they are developed, means in such persons where the tertiary type of syphilis is there, the heart of that person, it get affected. There is a development of aneurysm, means size of the arteries get bulged. They show bulging, they show swelling. Chronic granulomas is there. Meningovascular manifestation is there. Meningovascular means it is affecting the brain. And these tertiary lesions contains only few spirochetes and may represent manifestation of delayed type of hypersensitivity reaction. This tertiary stage of syphilis, it can be demonstrated by using the delayed type of hypersensitivity reaction. So these are the different stages. You can see here, this type of cancers, they are developed in the primary stage. In the secondary stage, there is development of rashes on the body of that person. Then latent stage is there. Then in tertiary stage, it may affect the brain. It may affect the heart, causing aneurysm, where the arteries of that heart, they get swelled. If that arteries get busted, means they get destroyed through the bulging, through the swelling, there is a large amount of bleeding is there, internal bleeding is there, which may be critical in that patient. So these are the various stages of syphilis which are shown by the patients. Now the next part is the laboratory diagnosis. Then how to diagnose? How we detect the presence of syphilis in a particular host, that is human beings. So there, in the laboratory diagnosis, there are two types of laboratory diagnosis it is carried out. First is the demonstration of spirochetes under the microscope. This is the first stage, where we are going to observe the presence of the spirochetes, bacteria, in that host sample which we have taken. Secondly, demonstration of antibodies in the serum, means demonstration of antibodies against this Treponema pallidum bacteria in the serum of that patient or in the cerebrospinal fluid of that patient. So there are two types of diagnosis procedures are there for the diagnosis of syphilis. First procedure is the demonstration of the spirochetes under the microscope. So firstly, we will say this. Diagnosis by microscopy is applicable only in primary and secondary stage. And in case of congenital syphilis with superficial lesions. Congenital syphilis means those childs up to the birth, they are having the inborn syphilis is there. Inborn syphilis is there. In such kind of syphilis we call it as a congenital syphilis, where we can observe superficial lesions in the newborn babies. In such cases, we are able to demonstrate the presence of these spirochetes with the help of microscopy. So what specimen we should collect here? We have to collect these samples to observe under the microscope. The samples, they have been collected from the lesions, but with proper care, because these lesions, they are highly infectious. Healthy person may get infection if proper care is not taken in order to collect the sample. Firstly, the lesions, it is cleaned in that person, in that patient who has suffering from this syphilis infection. These cankers, firstly we have to clean that with the help of gauze soaked in the warm saline water, and marginal gentle scraping. Gentle scraping is also done in order to release the spirochetes which are present in the lesions, in that cankers, so they can come out. So such scraping disturbs the superficial epithelial cell, so this pathogen comes out. And we have to apply also gentle pressure to the base of the lesions, and the serum that exuded is collected, preventing mixing of the blood. So when we collect the sample, there should be no mixing of the blood with that sample. After the collection of sample, firstly we have to prepare wet film. Means when we are in practical, we have seen that hanging drop technique in order to observe the motility of the bacteria. Same type of wet film is prepared in order to observe the bacteria, presence of this bacteria under the dark ground microscope. When we observe this bacteria under the dark ground microscope, you are able to observe slender spiral structures and slow movement that are shown by the spirochetes. And these samples which we have collected from the different sources, from the different organs, we are going to use that in order to demonstrate the presence of this pathogen in that patient. First method is to prepare wet film and observe the motility and the morphology of that spirochete under the dark ground microscope. Similarly, dark ground examination is useful, but negative results do not exclude the diagnosis of syphilis because it is of low sensitivity. Sometimes it may happen that under the dark ground microscope we are not able to observe the presence of these spirochetes. As you know that in this primary stage, the amount of this pathogen is very, very low, but it spread to the other parts of the body. Now, how much amount of the presence of these treponemas they are required in order to observe under the dark ground microscope here is 10 per ml in the exudates is required for the test to be positive. Means for 1 ml, in 1 ml of exudate, there should be 10 treponema bacteria is there. So we can easily demonstrate this under the dark ground examination or dark ground microscopic examination. Another method is available in order to demonstrate the presence of this bacteria in the sample. That is the direct fluorescent antibody test, which is particularly developed for Treponema pallidum, and it is better and safer method for the microscopic diagnosis of syphilis disease. Here, in order to carry out this direct fluorescent antibody test, we have to prepare a smear of the exudate. Then we have to fix that smear with the acetone and then send to the laboratories. Because this direct fluorescent antibody test, it is not carried out in simple laboratories, but we have to send that sample in laboratories where this facility is available. Now in these laboratories, this direct fluorescent antibody test for Treponema pallidum is done using fluorescent tagged anti-Treponema pallidum antiserum. Means such serum is developed there against this pathogen. That serum is used, and this serum is tagged with fluorescent dyes. And the antibodies which are used to bind with this Treponema pallidum, these antibodies, they are specifically monoclonal antibodies. And this combination takes place, these antibodies when we apply to that smear, these fluorescent antibodies when we apply to that smear and observe under the fluorescent microscope, you are able to observe this type of presence of bacteria. You can see here this fluorescent part, it is the spirochetes, that is the Treponema pallidum bacteria is there, which we have observed in the exudate, which we have taken from the primary or the secondary stage of the syphilis. So we are clearly demonstrate the presence of this bacteria in that sample by using direct fluorescent antibody test, which is particularly developed for the pathogen Treponema pallidum, which is shortly known as a DFATP. You can see here, we can observe this bacteria present in the presence of dark field microscopy. You can see here, this is the spirochetes bacteria, which is shown under the dark field microscopy. By using special kind of staining techniques such as Fontana's and Levedecky's method, you can observe presence of this bacteria in the samples also. Here is a fluid from canker which is taken and observed under the dark field microscope. You are able to observe the spirochete, presence of the spirochete. You can see here, these are the spirals which are having tapering ends. These are nothing but the bacteria, that is Treponema pallidum. So this is all about the